Hi, Dr. Mora here, operating at Restore. I have a very interesting case. This patient had a right shoulder labral repair in the past. They had some issues after surgery, small little falls, little injuries, and then the shoulder became painful again. So they had done initially pretty well, but then the shoulder became painful for some reason. And eventually I worked them up, and it turns out that perhaps they have something going on in their shoulder again. I did a repeat MRI. It's very hard to see pathology on a repeat MRI after the shoulder's been operated on because of the scar tissue and sutures, etc. So here we have a right shoulder. Patient is lying on their side. Okay, the right arm is being suspended here with a little bit of traction. And then you can see the shoulder here on the screen. And this is what we have. Let me show you what we have. So once again, it's a revision surgery, something that we have to do every once in a while. The patient had a labral repair, biceps, humeral head, socket, also known as the glenohumeral joint, long head of the biceps, superior labrum. So this area looks pretty good, not too bad. And then as we head towards the front of the shoulder, this is what we find. We find a loose anchor. Now this is a plastic type of material. We call it PEEK, which normally just stays in the bone, but in this case it pulled out, and it's probably damaging the head, or it can, if it hasn't yet. It can actually damage the head. Right now we can see a little bit of scuffing on the humeral head. So it's good that this patient is having the surgery because this anchor could actually destroy the joint. So the goal today is figure out why the patient is having pain. This anchor is part of it. Remove it, reattach, and see if there's anything else I need to do. So interesting case, revision, right shoulder surgery. Thank you.